Let's talk about poor outcomes from cataract surgery. And I'm Dr. Motwani from Cornea Revolution. Cataract surgery is really a miraculous procedure. You're taking out the old, worn-out lens inside the eye and putting a new artificial lens in. There are problems that occur. There's not a high rate of complications that are serious and severe, such as you can have, a dropped lens, you can have retinal issues like retinal attachment, you can have swelling of the back of the eye, these kinds of things. A lot of it can be treated. The really severe stuff like infection inside the eye or a dropped lens or serious retinal issues don't happen very often. What does happen, and is unrecognized on quite a number of patients, is that when the incisions are made, for the cataract surgery, where we actually make the incisions in the cornea to go in, that's where you have to go in with the instruments, where you have to put the lens through. Those incisions sometimes can act as what's called astigmatic keratotomy. What they mean is AK incisions. If they are not close enough to the edge, they can cause a distortion through the entire central cornea because they change the shape of the cornea by weakening it locally. So the idea behind cataract surgery incisions is to put them so close to the edge that local weakening doesn't affect the central vision. But what happens because these are handmade incisions, what happens if those incisions aren't close enough to the edge and they do affect the central vision? Well, those are the patients that start having trouble afterwards, okay? Those patients will have trouble in the way that they will have distorted vision, glare, halos, multiple images. They will have things look blurry and that can't be fixed with glasses. Those are where we do topography guided repair, just like we do for radial keratotomy, RK repairs, where we take the actual irregular cornea and we fix it. And that's how cataract surgery can be fixed in these cases, okay? So that's a topography guided repair, not a wavefront guided. The other problems with cataract surgery are really, the other main thing is it the correction that's off? And, if the correction is off, that means that the cornea is fine, but the lens that was picked, the formulas didn't work out right. Instead of 0, you end up +1 or +2 or -1. That can be fixed with glasses, a light adjustable lens, or with laser afterwards. A light adjustable lens is one that can be adjusted by a frequency of ultraviolet light that can change the prescription of the lens itself to bring the eye into better focus, okay? Then there's the other, like I had mentioned earlier, the more scary complications, endophthalmitis, which is infection inside the eye that can destroy the retina. Sometimes the lens itself, in rare conditions, you can actually have it fall through the capsule it's being put in and fall into the retina and need to be removed. Sometimes you can have swelling in the back of the eye. That's temporary. And if that happens, that usually goes away across a few months. And then finally, there's the secondary cataract, which is that the little bag that you put the lenses into can actually get opaque. And then you can laser that with a YAG laser, and that's covered by your insurance to fix that, okay? The stuff that really, the type of problems that people don't fully recognize or understand are these corneal irregularity problems from the incisions. And a lot of doctors just aren't trained or realize it can happen, don't even have the equipment to fully understand or to resolve that, and that causes a problem for certain patients. We've had patients come, looking for many years, looking for help with this. They've been looking for many years, but that can be resolved if somebody is doing topography guided ablation. So if you have problems with the cataract surgery, the number one problem is that the refractive error is off, okay? Number two, get the capsule checked. Make sure that you don't have a secondary cataract that we fix with a simple, what's called a YAG capsulotomy, okay? Number three, let's make sure you don't have swelling in the back of the eye, okay? Your cataract surgeon can tell you that or send you to a retina doctor to tell you that, okay? And if those things are all good, then and you're still having problems with your vision, then you may have incision-induced issues, corneal irregularity issues from the corneal incisions that need to be fixed.